Our collaboration with St. Mary's has been incredibly integral in strengthening our structure and process of managing our patients with chronic illnesses.
Childhood asthma is one of the biggest reasons that children are in and out of the emergency room.
The chronic disease home management program started to help provide more care in the home so that our patients did not feel the need to come into the hospital to see the physicians for every small issue that they had.
St. Mary's Healthcare System's mission is dedicated to improving the health and quality of life for children, young adults, and their families with medical complexities and special healthcare needs. We provide nursing, specialized occupational therapy, speech therapy, nutrition services, home health aid services, social work. We really provide holistic type of care for all these children. Our patient population specifically is such a unique population, and to service our patient population really requires that unique skill set. You have to be able to identify if a patient has a change in health status. Are they making a different facial grimace? Are they expressing themselves? Is a certain sound a discomfort? We know these patients. Nobody knows them better than our staff. And having that physician collaboration and partnership aligned with home care agencies is essential to the success of the program.
The home care nurses were really able to help us understand better what the needs of our patients were so that we could take better care of them in their own home.
We're working with the doctors. We're making sure that, is this a true medical emergency? Is there an intervention that we could provide in order to reduce that avoidable hospitalization, emergency room visit? We provide professional, skilled, intermittent visits. Nurses go out, they assess medication reconciliation, they educate families, they ensure that patients are aware of their disease prognosis, their status, what to look for, what are the signs and symptoms, and educate them.
We know that there is such an interaction between the environment as well as the genetics and the disease processes themselves, that it's incredibly important that we as physicians and providers understand what is happening with the environment at home, because that is where these children are primarily being taken care of. We are very interested in our outcomes such as emergency room visits, healthcare utilization, admissions to the hospital, and steroid use for our asthma patients, as well as emergency room and hospitalizations for our chronic disease patients, because those are our most vulnerable children, and these are the children at highest risk for requiring extra healthcare utilization. We have been very proud of the fact that we have been able to prevent emergency room visits and admissions for so many children by allowing that home care nurse liaison to really contact the providers early in a disease process so that we are able to treat exacerbations early in the homes and prevent extra visits to the physicians or to the hospitals.
Like every time he gets sick, I took him. Me and my mother took him. Hold on, last year he was in ICU in the hospital. Then they told me about the program.
They had an environmental issue here. Part of our role as an asthma nurse is to identify things that are going on within the home that can make them sick. Mom's been educated to try to keep track of how many exacerbations. He's had colds, allergy symptoms that seem to be worse. Jacob's going to be within this program a year in the summer. And he's different now. As you can see how he is, he's different. And I'm so happy.
He breathing better. Last year, he wasn't doing too good. Now this year, yeah, he'll be breathing better. The hospital, Miss Diaz. Well, for her, I can't do it.
Telehealth has allowed us to really monitor how they're taking their medication, when, and are they taking it appropriately, reducing any unplanned hospitalization. So we use it for medication adherence. We use it to monitor vital signs. Right out of the hospital, patients are at the greatest risk of ending up back in the hospital within 48 hours. Our telehealth program allows us to monitor any changes in vital signs. Families answer a series of questions on a tablet, and we're able to assess.
I think this program with the Bluetooth monitoring telehealth services is huge because they can be well and play and have a quality of life, and the families are not going back and forth to the emergency room or the urgent center.
We've been able to keep him out of the hospital and out of the emergency room when he is having exacerbations. He has not needed to go to the intensive care unit again and has been much better controlled since we have been able to remediate all of the environmental concerns that were in the home, as well as getting him onto his care management plan on a consistent basis. Many of our asthma patients have truly become much more adherent with their medications, controller medications, so that they are not requiring hospitalization or emergency room visits. We have had children who are requiring frequent courses of oral steroids prior to being involved in this program, and now that the home care nurses were able to go in and really educate those families, they have taken on that asthma self-management themselves so that they are able to care for their asthma in their own homes and not require visits to the emergency room every time their child is coughing or wheezing. We are now expanding our program to include children with other chronic illnesses, as well as pediatric patients with chronic neurologic disorders and psychiatric illnesses, which we think is going to be incredibly important in the current environment that we are all in.
The ultimate goal is to be able to provide a continuous monitoring program. In acute care hospital at home, we would like to create an early warning system with children with medical complexities, identify when a child may be decompensating or having a change, so we can intervene earlier and keep them out of the hospital, really creating like a transitional care team, having a physician in place, identifying a change in their status, and having that bi-directional communication with the goal of not having that patient go to a hospital, have an emergency room visit.
This is quite a team we've got put together here, and it works. It really does work.